Hi everybody, it's me again. I posted last week about my kidney cancer journey, and so I wanted to follow up this week and kind of tell you where I was at and what's ahead for me. It's funny because last week I just looked at the video and I have a bright pink shirt on, which is different than the one I have on today. So that's really funny that I have two of these. One of them has a hoodie. That's the one I wore last week. So I don't wear the same clothes every day. So I don't want you to think I do. So week 3. I am posted up week 3 last Friday. So it's 21, 22, 23 days. Feeling a little bit better. Had kind of a rough week. But I was able to work more than I had the week before. So each week I'm getting stronger and stronger, and so I'm happy to report that. Let's see. This week I'm going to visit with my surgeon on a Wednesday, and on Tuesday I meet with the oncologist. So we'll see what they both have to say. I'm hopeful for both appointments. I still have some side pain. I did end up calling my surgeon once this week. I think it was Thursday. I was just unable to get going, and I had a lot of discomfort, and so I called and talked to his nurse, and we kind of discovered that maybe I had been doing a little too much and needed to back off a little bit. So I did, and so I'm starting to feel better. Couple of things I want to mention. So if you have surgery, I had laparoscopic or the robotic kind. So I think there's 4 or 5 ports is what I had. I was left with what they call a JP drain until I left the hospital. I did not have to bring that home, thankfully. And but they forgot to give me what's called a belly band, and I did order one off of Amazon when I got home, and that has helped me a lot. So make sure if you have this surgery, you do not leave the hospital without asking them for, I don't know what the correct term is, but I call it a belly band. It's just an elastic, it goes around you and it Velcros across. And it has helped me with my recovery just to keep things kind of in place. Everything I think is kind of moved around when they're in there doing surgery. And, I've heard, that they push your intestines inside and, they move your colon and everything. And it takes a while, especially since they're, chippity chopping things in there too, for everything to get kind of resettled. And so I've kind of noticed that. I have a really deep port, I guess is what they call them. It's probably about this long, I guess. And it's right in one of the folds of my tummy, and it's deep. It's really deep. So they super glued me together. So I'm assuming on the inside they sewed me up. And then the ports, they just used this heavy duty super glue, which was fine because I think I actually healed better with that. But the one, I think where they did the actual, removal of the kidney and things, that one is still really sore and tender, and I'm having kind of a difficult time. Some of the things that I'm still experiencing is it's really tough to roll over in bed. I still have, not pain necessarily, but like a strain kind of feeling. And I really want to be gentle and careful. Sitting up really fast, don't do that. Bending over is the worst. So trying to tie your shoes, it sounds so stupid, but trying to tie your own shoes is just it's painful and it's hard and it sounds ridiculous. So what I've kind of done is I'll put my shoes on, and then I kind of laterally move my foot up, and then I kind of gently try to bend and tie them. Or I don't wear tight shoes. I'll wear a slip-on instead, and that has been good. But there are times, on the weekends, that I dress down and I wear tennis shoes. So I've had a lot of ups and downs this week. I'm going to be real honest with you. I think I've started kind of to experience a lot of the grieving process, and I don't know. I don't think I'm necessarily like grieving the loss of my kidney. I think it's just dealing with, the fact that I have cancer and that I can't do the things that I want to do. It's like in my mind, I feel like I should be able to do things, and then in my body doesn't do it. Then I get really frustrated with myself, and it brings me to a point where, I want to cry and I want to be angry. And I'm sure that all of these things are extremely normal. But it's tough. So, I'm trying to really increase my liquid intake and get used to drinking a lot of water. I feel very dry. I live in Colorado though, so Colorado, we're like so dry here. We have no moisture whatsoever, so we have to have humidifiers and it's crazy. So I'm going through a tough time. When I was in the hospital and on oxygen and things like that, it really kind of dried out my sinuses and everything. And so I'm having a really hard time kind of bringing that back. It's like I feel thirsty all the time, and I feel like I'm not getting enough moisture. Some things I have noticed is my color is starting to come back, so that's good. My hair is feeling healthier. Nails are feeling better. I don't know if I can attribute that to the cancer or what, but those kinds of things are starting to kind of come around to where I've really noticed some changes and some differences in that. Tummy is better this week. It's hit and miss sometimes. I still eat very cautiously. Don't go for the big spaghetti dinner, pizza, Mexican. I don't eat any of that. And if I was going to, I would do it really moderate. I mean, things that are like my friends right now are like baked potatoes with butter, macaroni and cheese, sandwiches I do okay with, but only like a half one. If I eat a full one, I don't feel good. So I've had to be really careful about how much I eat, because I think if my stomach kind of expands, then it pushes on maybe the kidney, or just, I don't know. But I just know that I feel physically better if I don't eat like to where I'm like over full. I do not want to do that, because then I'm miserable. I mean, I just want to cry and be, it's just miserable. So don't do it. Just be very kind and gentle to your body. And one thing I forgot to mention last week that I wanted you guys to know, and I've also kind of seen it on the Facebook page where it's, I think it's called Kidney Cancer Sucks, But We Will Win. So check that out if you're seeing me not through that Facebook link. I do post these on there. Night sweats. I forgot to mention that last week when I was talking to you, but I have had horrific night sweats. Yes, I know I'm a woman who's 50. I know it's not menopause. It's not that. It's something completely different. Like, I went through menopause, and I did the whole shebang, and but these are completely different. And I noticed there were some people that mentioned that, like after the surgery and that. So I don't know why we get those, but I had them pretty significant, and they're weaning. I'll have one once in a while, but they're not like they were like when I first came home. I mean, they were like drenching, like running in my ears, and just, I was so exhausted in the morning because my body was just trying to purge whatever. And anyway, so those are getting better. But I wanted you to know, if you get those, don't be surprised. It seems like it's kind of a normal thing after this. So anyway, I'm really looking forward to meeting with the oncologist and seeing what he has to say. My biggest fear at this point is not necessarily kidney recurrence, but that it's going to show up somewhere else. you know. If you go to the Facebook page, it's sad. You know, I think a lot of people were caught later. Again, just to remind you, mine was a stage 2B. They have different classifications. I think mine was a B because my tumor was so big. I had almost a 7 centimeter tumor, which is the size of a small lemon. So that in itself is scary because I had no symptoms really. Looking back and seeing like where I am now, I did start to have some urgency a couple years ago. What I attributed it to was the menopause and just getting older. I'd heard of women that, you know, I mean, there's commercials for it, you know, that you have an urgency to go, you know, to the bathroom. And I just kind of put myself in that category, you know, kind of ask my other female friends, hey, you know, do you experience this? And they're, oh, yeah, I do or I don't, you know. So I kind of thought I just fell into that category. But lo and behold, since I've had the cancer removed, I don't have it anymore. So I guess the last time I said that I had no symptoms, so looking back, I guess I can say that I did, but I didn't really attribute it to anything like being a cancer. I mean, never in my wildest dreams of cancers would I have thought that I was going to have kidney cancer. Nobody had it in my family, and I didn't really even think about it. You know, I kind of had just, you know, healthy, you know, and even, like I said, my kidneys were being monitored, which is crazy because I have rheumatoid arthritis, so they had put me on a drug called methotrexate, and when you're on that drug, you have to have liver and kidney function tests every 3 months because it's a pretty toxic medicine. And that's ultimately how they found the cancer, was that my liver functions were elevated just a little bit and everything in the liver was okay, and then they found the tumor in the kidney. But so just looking back, I can't really say, you know, other than extreme fatigue, you know, and I had kind of some mental dullness, but I'd had kind of a rough couple of years, and so I kind of just attributed all of those things to that. My mom was diagnosed 4 years before her death with Alzheimer's, and I was her primary caregiver with my dad, and I was working a full-time job and then caring for her at night, and she, you know, had the night wanders, and so it was rough. I mean, I wasn't sleeping well. So I kind of attributed that my, you know, mental dullness kind of to, oh, I'm not sleeping well. I'm in my early 50s. I'm going through menopause. And, you know, I could kind of wrap it up in a pretty little package and not really explore other options. And honestly, I think if I had even mentioned it to my primary doctor, she definitely would have attributed it to stress and, you know, the fact that my mom was dying. And, so that, you know, I just, looking back, it's just kind of hard to pinpoint exactly, you know, when things changed or, you know, if I even really noticed. But I do feel more mentally clear. I don't know if that has to do with the cancer or I just feel sharper. I feel like when I'm at work, I can focus and I don't feel like I'm, you know, kind of drifting off into, you know, many, many different tangents and things like that. I feel like I can kind of focus more and bring it more in. And so I just want to let you know that if you're out there and you're going through this, you're not alone, not at all. And use your support system. Don't overdo it. I mean, I'm preaching to the choir, but really don't. It's not worth it. And take care of yourself. You know, make sure you're eating healthy and make sure you're getting plenty of water to keep healthy. And subscribe to my page. I'm going to keep you posted next week. I'll let you know how the doctor's visits went. And we're going to continue this. And as I continue to make strides, getting better, I will keep you posted. And also, if you have any questions, like I said, I'm not a medical professional, but I've been in healthcare for 30 years and I'm on this journey with you. So, ask me. And I just want you to know I'm thinking about you all and praying for you. And I wish you all the best. So I will see you next week. Bye.